Hello everyone, my name is Betsy, Portugal. Today we will see Brazil's healthcare system compared to Peru's healthcare system. First, both countries are in South America and are neighbors. Here we can see the map. Brazil is blue and Peru is yellow. Each country has unique characteristics, including geographic features and a different environment. Brazil has a broader range of climates, from tropical due to the Amazon forest to humid and dry, while Peru has three distinct climate zones due to the Andes Mountains, resulting in different public health issues that we will see later. Here we have a snapshot of Brazil healthcare system and Peru healthcare system. Brazil healthcare system has public and private system, with private healthcare covering 56% and public healthcare covering 44% of services. Peru shares this approach with 64% of healthcare spending is financed by the government. 36 is financed through out-of-pocket payments and private health insurance. In 2024, Brazil spent more on healthcare compared to Peru. Brazil had a GDP of approximately 10,000 millions, while Peru has a GDP of approximately 8,000 millions. Brazil has a population of 211,695,000. Peru has a population of 33,845,617. The physician density is 1.16 in the northern region and 2.81 in the southeast region, while in the capital there are 5.07 physicians per person, showing a clear disparity. In Peru, there are 1.62 doctors per 1,000 inhabitants. The strengths: Brazil has increased investment in healthcare through the creation of the unique system of health called SUS and the popular pharmacy, which increase access to care, reduce costs, and help address health inequalities and reduce infant mortality. In Peru, the strength was the increase of life expectancy, reduced infant and maternal mortality due to the expansion of the unique health system called SIS. Similarities: both countries have a decentralized healthcare system funded by the government and private sector. Brazil's public health system offers free and universal access to healthcare service through the unique health system called SUS. Peru's public health system are provided by the comprehensive health system called SIS, which is funded by the government. The healthcare systems are primarily based on fee-for-service. However, patients often have to pay out-of-pocket for private healthcare to avoid delays and access to better quality services. Both countries show disparities in access to care, particularly in rural areas and vulnerable populations. Now we are going to see the health indicators of Peru and Brazil. Health indicators are essential for assessing a country's healthcare system performance, as they quantify health characteristics within a population, providing information about the health status and allowing us to evaluate the effectiveness of the program and policies. Also allow us to take actions to improve health outcomes. Peru and Brazil have similarities regarding their health indicators. Regarding the population, the prevalent population are between 15 and 60 years old, and both countries are predicted to shift towards older adults by 2050. Life expectancy. In Brazil, life expectancy at birth has increased by approximately 0.8 years from 70.5 to 72.4 years. Peru has a similar increase in life expectancy. The population growth or decline can impact a country's sustainability, affecting its resources, infrastructure, and services. If a country is not prepared to handle an aging population with health issues, it can strain healthcare system, potentially leading to increased demand for medical service. This also can cause social disruption and economic burden. Vaccination coverage. We have here a chart with a comparison of vaccine rates. Brazil vaccination rates for Tdap in 2023 were 90%, in Peru was 84%. Here the BCG for Brazil was 79% and Peru 87%. Influenza for Brazil was 90% and Peru 84%. Measles 87% for Brazil and Peru 84%. Polio vaccine 85% for Brazil and 84% for Peru. Yellow fever in Brazil 70% and Peru 61%. Brazil and Peru have high vaccination rates for critical childhood vaccines, with Brazil having higher coverage for Tdap, influenza, and yellow fever, and Peru has a higher coverage for BCG vaccine. Measles and polio vaccine rates are similar between the two countries. Immunizations are important because it's a cost-effective public health intervention that protects vulnerable populations, enhances herd immunity, prevents disease spread, and reduces healthcare costs by preventing costly treatments. Hospitalizations also prevent millions of annual deaths. Non-communicable disease. Brazil is facing a high prevalence of chronic non-communicable disease, with 74% of deaths attributed to non-communicable disease in 2016, including cardiovascular disease, hypertension, diabetes, and cancer. All of this is due to risk factors including smoking, unhealthy diets, and low physical activity. Additional social determinants such as education, occupation, income, gender, ethnicity, and rural areas contribute to this prevalence. In Brazil, National Health Promotion implemented a program called Vigitel to reduce the non-communicable disease, but has shown limited improvement due to political, economic, and institutional crises. The non-communicable disease in Peru, they share the same trend as Brazil, with the first being cardiovascular disease such as ischemic heart disease and stroke. Both countries face significant public health challenges to non-communicable disease and social determinants of health, being cardiovascular disease a major concern needing interventions. Communicable disease. Brazil has a high prevalence of communicable disease, especially in the vulnerable population and rural areas. Diseases such as COVID-19, vector-borne disease including dengue, Zika, yellow fever, and malaria, along with diseases such as tuberculosis and leprosy. For example, in 2024, Brazil had leprosy with almost 14,962 new cases, placing Brazil second in the rank of countries following India and Indonesia. This leprosy is almost eradicated in most parts of the world. In 2022, the Northeast region had more reported cases of tuberculosis and 19.5 HIV cases per 100 individuals compared to the southern region in Brazil. The difference in this prevalence could be attributed to socioeconomic status, lack of healthcare access, and the presence of the Amazon forest, highlighting that infectious diseases disproportionately affect communities with limited healthcare access, environmental factors, and the lack of qualified medical professionals, perpetuating poverty and health. Therefore, addressing infectious disease necessitates a comprehensive strategy that involves involves reinforcement in healthcare system, promoting social equity, mitigating environmental risks, and fostering intersectoral collaboration. Another health indicator that we will see is mortality rate, including mortality rate for children under 5 years old, maternal mortality, and adult mortality. Mortality indicator is a vital health indicator that reveals disparities in mortality rates due to factors such socioeconomic status, education, and health care access. In Brazil, the children's mortality rate in 2023 was 15 deaths per 1,000 births. In Peru, there were 13.5 deaths per 1,000 births. The causes for both countries were perinatal conditions, congenital malformations, respiratory disease, infection, and parasitic disease, indicating high inadequate healthcare, nutrition, sanitation, and socioeconomic disparities. Regarding maternal mortality, Brazil reported 107 deaths for 100 births in 2021. In Peru, they report 51.9 deaths per 100 in 2023. The maternal mortality was due to lack of access to quality health care, resources, and attention, as well as hypertension, severe bleeding, infection, and childbirth complications, and unsafe abortion. The mortality rate for adults in Brazil in 2023 was 169 deaths per 1,000 people, while in Peru was 137 deaths per 1,000 people. Both countries experienced increased adult mortality due to cardiovascular disease, cancer, followed by road traffic accidents, homicides, and suicides. Brazil and Peru health indicators show mixed results, with some mortality reductions achieved. Challenges include healthcare access, quality, and socioeconomic disparities, necessitating targeted intervention to improve health outcomes and reduce inequalities. Also, the continued monitoring of these indicators is essential to track progress and guide public health efforts. In conclusion, when comparing the healthcare system of Brazil and Peru, it's evident that both countries have made notable progress in expanding coverage for their citizens. Brazil in particular has achieved significant advancement through its unified health system, which aims to provide universal health care. However, the country still faces persistent challenges, including an unequal access to service, varying quality of care, and uneven distribution of healthcare professionals. Additionally, Brazil continues to deal with a rising prevalence of non-communicable disease, especially among adults, as well as ongoing issues with infectious disease such as leprosy, highlighting the necessity to improve healthcare access, equity, quality, workforce distribution, disease prevention, and sustainable funding to improve outcomes. Here are the reference. Thank you for your attention.